Good evening, guys. So, Dr. Vinish this side. If I'm visible and audible, can you give me a thumbs up? So, we'll start this interactive session. If I can get a thumbs up, guys. So let me start with the session. Okay. In between, if there are any questions or doubts, I'll try to solve them also. You can ask me the questions as well. So I'm just waiting for a confirmation from all of you. Okay, so if I'm visible and audible, can you just give me a thumbs up? So I'll start with the session. So this is image based discussion and MCQs. Okay. So what we are doing today is an image based discussion. Okay, so let me just begin the session by introducing myself to you. In between, whatever questions are there, I'll take them as well. My name is Dr. Vinish Srivastava. Presently, I'm the head of the department and senior consultant in anesthesia and critical care at Fortis Lafam Hospital in New Delhi. Before this, hi Dr. Mazin, greetings. Okay, so this is a small discussion that we are taking today on MCQ session from anesthesia. All right, so introduction about myself. I'm the head of the department and senior consultant in anesthesia and critical care at Fortis Lafam Hospital in New Delhi. Before that, I was working here itself as a senior consultant for the last 8 years, Fortis Lafam Hospital, New Delhi. Before that, I was at Maulana Azad Medical College. I've done my senior residency from Maulana Azad Medical College and I've also been a specialist over there. Prior to that, I've done my DNB secondary anesthesia. That's from Deen Dayal Upadhyay Government Hospital, New Delhi. Before that, I've done my DA in FCPS from Grant Medical College, Mumbai, anesthesia. Before that, I've done my respiratory medicine. I'm also qualified chest physician from Lokmanya Tilak Medical College, Sion Hospital, Mumbai. Before that, I've done my hospital administration. And before that, MBBS. Apart from my clinical duties, which all of us are doing, all of you also in fact, okay, apart from the clinical duties even in these times, I also like to play the guitar and I always tell everyone, kindly keep a hobby which can de-stress you guys. Okay, so here I'm playing with a local folk band, and along with these things I also teach students preparing for postgraduate medical entrance exams and foreign medical graduate entrance exams for the last 10 years. Okay, so now I'm associated with Unacademy and you can see, thank you for all your dedications and all the feedback that you people give me. That is what gets us back to teaching apart from the clinical duties. This was just recently from Dr. Aziz. Thank you so much. What I'd like to say is that we are all trying to teach you the subject in a manner where the concepts become clear and it becomes simplified for you so that you can appear in the exams and the concepts are totally clear. This was a recent INI CET which was held for the central institutes, and as you can see from the discussion in the class, the students, all of them have said that questions come. The questions have come from what we have discussed because we are discussing the concepts. Once your concepts are clear, of course the questions are going to come from the same way. Before I go forward, I would like to tell you guys also that you have to use a code to unlock anything nowadays. You can use my name as the code or any name that you have or any other code that you have, Dr. Vinish. So DRVINISH. at the Unacademy platform, everything has to be unlocked now. Okay, even the free things, you can download the app, and after that, whatever free sessions we have, everything which is there on the app can be downloaded only after using by unlock code. So you can use Dr. Vinish, and the same thing is my Telegram ID also. So if anyone wants to get in touch with me, DRVINISH, you can just search for me t.me Dr. Vinish, and you can contact me on Telegram. The same name is my Telegram ID as well. Just before going forward, 2 minutes about telling you the fact that hopefully you people are aware about the iconic subscription that we have, where we have the Unacademy along with the prep ladder. Okay, it's a combination of things, and I think it's one of the best things possible. Okay, you can follow us on Telegram and Instagram with Unacademy as well. So what I was talking about is the iconic subscription, which I feel is one of the best things, where you're getting the live classes I'm taking right now on YouTube. So we have so many YouTube sessions that you people can go through. Along with that, we have those special classes which are completely free. Okay, apart from that, we have this iconic subscription or the plus course that you can go in for. So live classes and batch courses from Unacademy, live tests and quizzes which keep on happening, and in prep ladder you have those video lectures and question bank and rapid revision courses. So it's like best of both the worlds combined together in the iconic subscription. I told you need to have a code now. You can also use my code, my name as the code. All right, it also makes you 10% off on the subscription that you take. All right, so this is how you go about it for the kind of thing that you choose, plus for the iconic. All right, you have to use a code for anything that you do. You can use Dr. Vinish as the code. You have to put it in the box here, and then you can proceed ahead. Normally we advise is a 1 year subscription for people who are preparing for the next year exams. If you are already prepared, yes, you can go in for a short one. Plus course, guys, is where in case you don't want an iconic part, plus course is also good. Normally we always say for preparing people having 1 year of time, go in for a 12-month subscription. Otherwise, who have just prepared can take 3 months or 6 months as well. Here also you have to put in a code. You can use Dr. Vinish as the code and proceed ahead. Okay, guys. Apart from that, this is a daily NEET PG 20 questions MCQs every day at 8 p.m. and at 9 p.m. We have MCQs 20 questions every day. You can attend these series live test. Okay, these are MCQs, and you can answer them and check as to where you are placed. You can you have to use a code, guys. So you can use my name as the code or any other code that you have that can be used. Okay, now download the app, use the code, and you can go through all the sessions. Remember, YouTube is already available here at the platform. Apart from that, with the code you can go to the completely free sessions which are called special classes. All right, and they are completely free. You can use the code. Okay, guys. Now remember, you have to use the code. Without code, nothing happens at Unacademy now. You have to use a code to unlock everything. So remember that. All right. So going forward now. So I would like if you guys can answer also. So this following image indicates what? ASA. I'm giving you 4 options. I would like to get the answers also. If you can give me the answers, then we'll have a discussion based on that. So this is an image based discussion. The following image indicates ASA grade 2, difficult intubation, difficult mask ventilation, none of the above. So anyone? What answer out of the options that you have? I'm just waiting for that, and then we'll discuss it out. So I'll give a time for about 30 seconds. Dr. Chandan gives an answer A. Anyone else, guys? Any other answer? Anyone else? Then I'll discuss it out. Okay, Dr. Chandan. So the point is, Dr. Chandan, that's not the right option. Okay, Dr. Chandan, that's not the right option because it was something to confuse you, and that's how questions come in the exam. This following image, I think Dr. Mazin says D. Absolutely correct, Dr. Mazin. Absolutely correct. Absolutely correct. Because this is what is Malam Patti grading. Okay, MPC, Malam Patti. It is not ASA grading. Correct. The point is, Malam Patti grading is done to see for difficult airway. All right. So difficult airway means what? So Malam Patti grading is done to assess difficult airway, which means you have to assess difficult intubation and difficult ventilation. Dr. Snehal says D. Absolutely correct, Dr. Snehal. Absolutely correct. Okay. So absolutely correct. So this was a confusing question. The point was I had written deliberately grade 2 to confuse, and that's how questions are set up in the exam. Had these been MPC grade 2, this would have been the correct answer. Or had I written easy intubation, this would have been correct answer. Had I written easy mask ventilation, this could have been correct answer. Why? What is Malam Patti? So let's go and see what's Malam Patti. How it is done? You open the mouth, alright? Open the mouth, extend the tongue. Okay, the tongue has to be extended, and you look at the posterior pharyngeal structures. Okay, you will look at the posterior pharyngeal structures at the back of the pharynx. Alright, so this is your Malam Patti grading. So there are different grades that you see. For exam purposes, I know all of you are preparing. Simple thing, just look at the uvula. If you can see the complete uvula, it becomes class 1. If just the tip of the uvula is not there, for example, if I cut the uvula like this, just the tip is gone, it becomes Malam Patti class 2. Now you cut the uvula from the base, all you see is the base of the uvula, it becomes Malam Patti class 3. Alright, and if you further cut the soft palate, it becomes Malam Patti class 4. Okay, so therefore in class 4, what is seen is only the hard palate. In class 3, what is seen is hard palate, soft palate, and the base of the uvula. Okay, base of the uvula. When you come to class 2, remember it's just the tip of the uvula that has disappeared. Tip of the uvula has obscured, disappeared. Okay, Malam Patti class 1, you can see everything. So what is everything? You can see complete uvula, you can see the tonsillar pillars, you can see the soft palate, you can see the hard palate. Okay, so all of them are visible. Why is it important? Because they say the mouth opening and the posterior pharyngeal structures are a reflection of the glottic opening. Okay, so they say if you can see the complete uvula, probably you will be able to see the vocal cords. Probably. Huh? So therefore in Malam Patti 1 and 2, when you try to put a laryngoscope, you will be able to see vocal cords. This is called as a Cormack-Lehan grading, laryngoscopic grading. This itself can come as a MCQ question. So Malam Patti class 1 means you will be able to see the vocal cords completely. Malam Patti class 2, yes, you will be able to see the vocal cords. Malam Patti 3 and 4, you see, you will not be able to see anything. So that is why Malam Patti 1 and 2, you will find vocal cords are seen. Malam Patti 3 and 4, vocal cords are not seen. This means Malam Patti 1 and 2 becomes easy, supposedly easy intubation and mask ventilation, and Malam Patti 3 and 4, they become difficult intubation, difficult mask ventilation. Guys, is this point clear? That is what is called Malam Patti grading. Then what was ASA? ASA grading, guys, is American Society of Anesthesiologists grading. Okay, that's a separate question by itself. American Society of Anesthesiologists grading, it tells you about the physical status or the medical status of the patient. Alright, that's a separate question in itself. So this was about the first question that we discussed. Any questions or doubts? Otherwise, give me a thumbs up. I'll go forward and discuss the next question. Dr. Snehal, Dr. Mazeen, Dr. Chandan, and other guys who are there. I normally like to have it interactive so that it becomes easy. So let me go forward to the next question. Okay. Hopefully this point is clear. A doctor on the duty asks a technician to get the following cylinder. So please identify a common question like this comes so often. Please mark your answers, guys. A is Entonox, B is oxygen, C is air. Okay, Dr. Mazeen. Dr. Akshay Mohan also says okay. Fine. So please mark the answers, guys. Entonox, oxygen, air, or carbon dioxide. Yes, I would like to wait, because once I get the answers, then I'll be okay with that. Okay, then I'll discuss after that. I haven't got anyone as yet. Any answer from? So Dr. Akshay gives an answer D. Dr. Chandan gives an answer D. So correct. Absolutely correct, guys. So Dr. Akshay, Chandan, both of you are correct. I'll not waste any more time and just discuss the concept behind it. This is what is carbon dioxide cylinder. Absolutely correct. How now? There are different ways to remember cylinders here, but I just tell one thing, that Dr. Ajay says D. Correct. Dr. Ganesh Murthy Bhaskar says D. Correct, yeah. All of you are correct. So just give me 2 minutes to tell you how the colors, how I remember, and how I tell students to remember. Okay, everyone has a different way of teaching and remembering also. For me, what I say is that whenever you see something white, it will have oxygen. The same question has been asked as oxygen knob so many times. What is the color of oxygen knob? So whenever you see white in the pipeline, whenever you see white in the anesthesia machine, you see that rotameter, everything white somewhere has oxygen. You have to remember that. Therefore, all of you know oxygen cylinders are what? Black with white shoulder. Okay, all of you know that oxygen cylinder is this one. Okay, oxygen, it's black with white shoulder. This is oxygen. All right. So therefore, wherever there is oxygen, you will have some component of white. So what cylinder is this? You get gray with white. So what is this? Gray, guys, is carbon dioxide. Okay. Now you go to the composition of air. Oh, sorry. Why did a mistake here? Dr. Chandan, Dr. Akshay, sorry. The answer is C. Dekho, my fault. It's air, what I had shown. See, sorry. Okay, my fault. Maybe Dr. Mazin was right. So Dr. Akshay, Dr. Chandan, Dr. Mazin, Dr. Ajay and Dr. Ganesh, including me, all of us are wrong. The correct answer is, it's not carbon dioxide, it is air. All of us are wrong. Okay, including me, and that's how we make mistakes. So this is air because it contains carbon dioxide and it contains oxygen. That's how you remember. Carbon dioxide, guys, is gray in color, as you see over here. Oxygen, then you see, is black with white shoulder. Okay, so this is oxygen, you get black with white shoulder. Nitrous oxide, guys, is blue in color. Therefore, Entonox, guys, is a combination of oxygen and nitrous. So you get oxygen and nitrous here. So you realize wherever there is oxygen, it is white in color. It is my fault. Okay, it's my fault that I marked out the wrong answer. The correct here was air. Okay, so my fault. I take that thing back to me, but I hope this point is clear. Hopefully. Okay, the whole point was having a discussion. Yes, guys. Okay, so just remember, wherever you get anything white, the whole point was to say wherever you get white, there has to be some component of oxygen involved. So therefore, black with white shoulder is oxygen. When you get gray with white shoulder, it becomes air. Air contains 21% oxygen, 78% nitrogen, and the remaining 9% carbon dioxide, moisture, and other gases. Okay, so hopefully none of us will forget it again. Okay, guys. And this blue color, everyone knows, is nitrous oxide. So it becomes easy to remember all the 5 which are asked in the exam very often. Okay, thumbs up all of you. Clear? Shall I go forward? Next question. Thank you, Dr. Mazin. Good. All of us have got a clear concept now. Okay, that's how concepts become clear. Right? So the whole point was to see that white color. Wherever you see white, remember there's going to be oxygen. Now, which of the following can be used for the procedure being done? Okay, you can mark multiple answer also, guys. Multiple also. So I've given A, B, C and D. There are 4 of them. Which of the following can be used for the procedure being done? In case you find there are multiple options, even they can be right. In case. Okay. So Dr. Chandan gives an answer D. Hopefully I will be right this time around. Others, Dr. Akshay, Dr. Mazin, Dr. Ganesh Murthy, Dr. Ajay. Fast, then I'll discuss also here. I want to discuss as well. Okay, so I waited for some time. Let me give, maybe it's, not getting the responses fast at my end. Oh, Dr. Mazin says D, Dr. Ganesh says C and D, Dr. Akshay Mohan says B and D, Dr. Suman says D. Guys, so all the people who have said D, only D is correct. Methohexytol, absolutely correct. Okay, halothane is not used. Remember, it's an inhalational agent. First of all, let's see what it is going on. What is going on is a electroconvulsive therapy. What is done in psychiatry? Okay, ECT. In ECT, the name itself suggests electroconvulsive therapy. Means you want convulsions or seizures to take place in the patient. That's exactly why you're giving a shock. Alright. Now, yes, it's ECT. Now what happens is, methohexytol, guys, is a drug which belongs to the group barbiturate. So barbiturates normally are actually anticonvulsants, all of them. So you guys must have known about phenobarbital. Okay, you guys know about thiopentone from anesthesia. All these drugs are great anticonvulsant drugs except methohexytol. Methohexytol, guys, is a pro-convulsant drug. It actually causes convulsions. Methohexytol causes seizures in the patient. Therefore, methohexytol helps the ECT to take place. Okay, and that is why the correct answer here is methohexytol. The point is, why haven't we heard about it and why isn't it being used often? And the reason is the side effect. Methohexytol has a side effect which is HPA axis suppression, hypothalamus pituitary adrenal axis suppression, and because of that you will get no catecholamines, okay, no steroids, can lead to death of the patient. One side effect is this. The most common other side effect is nausea, vomiting. Because of these two reasons, methoxytol is not used anymore. However, if it's asked in the exam, then ideally the drug of choice remains methoxytol for the simple reason that it helps the ECT. Okay, everyone, all right? However, nowadays, because methoxytol is not supposed to be used, so people what are using now? Nowadays what is being used? Okay, so what is being used now is thiopentone or propofol. Remember, these are anticonvulsants. They are not going to help the procedure. They are anticonvulsants. However, they are used followed by succinylcholine, and then you give the ECT. This is what is being done nowadays. Okay, so the point is anticonvulsants are not helping the ECT to take place. However, we are giving it for anesthesia. I am not taking care what is happening to the ECT, whether it's helping or not. Let the people give more shock. But I have to ensure that the patient remains safe. To make the patient safe, we prefer to use thiopentone and propofol, which are being used, and we don't use methoxytol anymore. Hopefully that point is clear. Halothane is an inhalational drug. It is not used for sevoflurane. It's given from an anesthesia machine. It is not used outside this way. It's not used. Ketamine is not used. Ketamine increases all of you would know, ketamine is some drug which increases everything in the body. Increases heart rate, increases BP, increases intracranial pressure, increases intracerebral blood flow, everything increases, everything. It maintains respiration. Okay, apart from that good factor, everything is increased in the body. It's not used for that. What is droperidol? Droperidol, guys, is a neurolept anesthetic drug. Neurolept anesthetic. By the way, it means the same thing. Neurolept means antipsychotic drug. So droperidol is brother sort of haloperidol. All of you must have heard of haloperidol. Okay, so this is used for neurolept anesthesia, droperidol, because droperidol is a very good sedative agent. It puts someone to sleep, and a very good antiemetic agent. So someone might argue, yes, it can be used for when you're saying ECT. However, droperidol is not used nowadays. It was used before for short procedures. Nowadays, again, it is not used. The only place where we use it nowadays is for antiemetic, in case you want to use it. Apart from that, it is not used anymore for its effect. It was used for short procedures before. Nowadays, it is again not used. Okay, hopefully these points are clear. All right, so let me take the next question. Okay, all of you have already given me a thumbs up. It's nice to see that. So kindly identify the instrument. I'm giving you 4 options. Okay, so bispectral index, A, B is neuromuscular monitor, C is nerve stimulator, and D is arterial line. Dr. Mazin says, what does neurolept anesthesia mean? Okay, Dr. Mazin, let me clear that out. Oh, maybe I'll just finish this point and then I'll discuss Dr. Mazin. Done. Let me finish this point. Dr. Chandan gives an answer B. Dr. Charak Roy has given a clap. You could have marked the answer. Dr. Aniketan says B. Dr. Shivam says C. Other guys. So anyways, okay, Dr. Mazin, I'll take that definitely. I'll just explain once I'm done with this part. Okay, so the following instrument that you see, correct, there has to be confusion between 2 of them. You people are sure that it is not bispectral index. You people are sure that it is not arterial line. So the confusion has happened between neuromuscular monitor and nerve stimulator. So therefore, and I knew it, that's the reason we set it up this way. Correct. The correct answer is it's a neuromuscular monitor. It is monitoring the neuromuscular junction. Hence, you have something which is monitoring the nerve. Something is going to the nerve and you're seeing the response to the corresponding muscle. This is what is a neuromuscular monitor. It is just to see the effect of the skeletal muscle relaxants. This question is a common question between physiology, pharmac, and anesthesia. KD Tripathi, you'll find these graphs, fade, no fade, all this is seen with this neuromuscular monitor. Okay, so this is a neuromuscular monitor, the most common nerve. So what is it doing? Monitoring the neuromuscular junction. Muscle relaxants work at the neuromuscular junction. Okay, so what are you doing? Monitoring the nerve. The most common nerve monitored is the ulnar nerve. If ulnar nerve is not available, you will try to see the facial nerve or the posterior tibial nerve. Common ones. But the most common is always ulnar nerve. MCQ question asked so many times. The corresponding muscle would be the adductor pollicis muscle. So most common nerve, ulnar nerve, most common muscle is adductor pollicis muscle. Okay, so this is to monitor the effect of muscle relaxants like vecuronium, rocuronium, atracurium or pancuronium, DTC, all these muscle relaxants. It's to see that. Correct, Dr. Chandan? Adductor pollicis and ulnar nerve. Absolutely correct. Now, what is bispectral index? So let me just rub it off. This is bispectral index, guys, where you have monitor attached to the forehead, electrode sort of a thing. It gives you a number between 0 to 100 and it tells you the depth of anesthesia. How deep is the patient under anesthesia, whether the patient is awake or the patient is sleeping. If the patient is awake, the number is close to 100. If under GA, the number is 45 to 65. Okay, so it gives you a number between 0 to 100. That's it. Simple monitor. All right. This is bispectral index. Next, this is nerve stimulator. This is where you would have got confused. Nerve stimulator is used to give a block. Okay. So what it does, yes, because you will be seeing something like this. However, it has a needle, and this needle is used to pierce some muscle to find the nerve inside and then give a block. Okay, so this is what is called a nerve stimulator. Specifically, I kept a diagram for that. Hopefully you've understood. Okay, so that's the nerve stimulator. Arterial line, all of you know, is this. Okay, normally the most common artery used is the radial artery. Again, MCQ question. Radial artery is the most common, and whenever you use it, remember Allen's test. Allen's test, very important. These are all MCQ questions and points over here. Now coming back to neuromuscular monitor, the most common mode used is the train of 4. Okay, this question has been asked many times. Train of 4 is the most common mode used in the neuromuscular monitor. All right, what happens when you have given a non-depolarizing? You get to see fade. Fade means, can you see the first response, second response, third response? It comes like down. When you give succinylcholine or depolarizing, you get the same height. Okay, so normal stimulus is this. Each stimulus is of 2 Hertz given in a span of 2 seconds. Okay, if you get a depolarizing block, you will get a fall in height which is constant. Non-depolarizing, you get to see fade. Okay, this comes as a picture diagram also. Now just to clear Dr. Mazeen's point, Dr. Mazeen wanted to ask what is neuro-left anesthesia. Okay, this again question comes very often. What is neuro-left anesthesia? So therefore guys, what people did was they took droperidol, okay, and they combined it with fentanyl. So what was droperidol? I told you it's a very good sedative agent, very good antiemetic agent. Okay, fentanyl is a opioid. So when you started giving this to patient, this was called as neuro-left analgesia or pain-free patient. Okay, patient does not have pain because of what is neuro-left. Neuro-left means antipsychotic. Hence you call neuro-left malignant syndrome. So antipsychotic medicine. So analgesia because of antipsychotic medicine. Now to the same combination of droperidol, fentanyl, you add nitrous oxide. This is what is called as neuro-left anesthesia. And this was what was used for short procedures initially. Nowadays it is not used anymore. So Dr. Mazeen, hopefully the point is clear. Neuro-left, the point name neuro-left itself means antipsychotic. Okay, so anesthesia because of antipsychotic drug or analgesia because of antipsychotic drug. Okay, so guys, another question, all questions are there, but I hope you are aware we are also having a complete session for people preparing in 2022 next. So evening batch, morning batch, both is there. I'll be taking the month of January and I'll be taking the evening batches. So these are all other educators along with us. This is what you get at Unacademy. So it depends. I mean, you might like someone else's way of teaching also, not necessarily my way. So there are many people that you can join. And remember, you always have to use a code for any of the free classes. You just have to download the app. Okay. And then unlock code you have to use. Okay. Whether it's for special class. This is some of the feedback for the other classes that you have seen. You know, all of them have just said this is where we try to clear the concepts. Okay. It's always the concepts that we focus upon. All right. So this is for the month of September. You'll have the same thing for the month of August. Everyone has written the same thing. I would like to thank all of them. Going to the next question. Okay. So thank you for everyone. This is right from the month of June, July onwards since the time we've been associated, right? So remember, you have to unlock it with the code. You can use my name, Dr. Vinish, and the same thing is my Telegram ID. Now, kindly identify the laryngoscope blade. There are 4 options. Please mark your answers, guys. I'm taking the class for another 10 minutes. Huh? Is that okay, all of you? Though it was a half an hour session. So Dr. Aniketan says C. Anyone else? I just got one answer. Dr. Deepesh says C. Dr. Akshay says A. Dr. Ganesh Murthy says D. Dr. Chandan says C. Dr. Rahul says C. So again, confused? Anyone? Dr. Harshita Cool says C. Dr. Ken says C. Kiddie Quiz says A. Oh, all of you are confused. So we need to talk about it. All of you are confused. So the point is only one answer I've got correct. Dr. Ganesh Murthy Bhaskar, absolutely correct. It's none of the above. None of the above. It is not Miller. It is not McCoy. It's not McGill. Okay. So this is what is called as a Macintosh blade. Macintosh blade, Macintosh laryngoscope. This one, it's a curved blade. MCQ question. A curved blade, Macintosh blade. Where is it used? Adult. Bigger name Macintosh, used in bigger person, adult. What is Miller? This is the next one. Straight blade is called a Miller blade, everyone. Okay, so this is Miller. Hopefully now everyone has an idea about it. So this blade that you see is called Macintosh blade. Used for adults. Bigger name, na? Macintosh. Used in adults. Miller, smaller blade. It's a straight blade used in children. Macintosh is a curved blade used in adults. Okay, so all these are MCQ questions asked in the exam. All these points. Alright, used for intubation. McCoy. Let me just show you what is McCoy then. This is McCoy, guys, which is used in anesthesia for difficult intubation. I have just used one of them today. And I was unable to intubate with this also, so I used something called as bougie. Again, MCQ question. They ask you what are the aids to intubation. One of them is this McCoy. Okay, I didn't plan it, but still. Okay, that I am going to, this question had already framed, but I used this today itself and I was unable to intubate. Even with this, it was such a difficult intubation. So I used something called as bougie. They ask in exam also, what is bougie? So bougie, stillet, all these things are there as aids to intubation. Okay, apart from laryngoscope that you see, so bougie, stillet are all used. Remember that. What is McGill? This was an old laryngoscope that you see here. Okay, so this is McGill laryngoscope, this one. It is not used anymore. Alright, but still it was just given to confuse you guys up. Hopefully you got confused also. Alright, that's how questions come in the exam. Huh? I'm not joking. When I was at MAMC, Maulana Azad Medical College, we actually had a class to tell how to set up questions. Next question. What is this device? Very jaldi, fast. Dr. Aniketan says an answer. Dr. Akshay gives an answer. Correct. Dr. Anyone else? Dr. Mazin says LMA. Dr. Mazin, there are two LMAs. Dr. Rahul says A. Dr. Ganesh Murthy says A. Okay. So let me give the answer. See, most of you have given A is the correct answer. It is the ProSeal LMA, guys. It is the ProSeal LMA. Okay. It's not Giddle. It's not iGel. It's not Classic. Any spoon-shaped device that you normally see in an exam would be a LMA. Okay. LMA. So what you see here is a ProSeal LMA. The difference between a Classic and a ProSeal, guys, is the presence of a drain tube in the ProSeal. Okay. This is the only difference. As you can see, of course there are other things also, but at your level this is the only thing you need to remember. This is your Classic LMA, which is routinely used. Problem is, Classic LMA does not prevent aspiration. So therefore they added a separate channel from which you can pass a Ryle's tube directly inside the stomach. This can lead, from here you can aspirate a stomach content. Okay, and that is why this is what is called ProSeal LMA. So any spoon-shaped device that you see in exam is sort of an LMA. This is a Classic LMA. This is ProSeal LMA. It has an added channel from where you can pass a Ryle's tube that goes inside the stomach. Okay, this can help you take off any stomach contents in case some patient is full stomach. Important thing is this can be used for IPPV, positive pressure ventilation. This that you see is called an iGel. Remember, it also looks like an LMA, but there is no cuff. There is nothing to inflate. Just see, LMA has everything like a endotracheal tube, a balloon, a cuff. This has no cuff. It just has a gel pad which you insert directly in the patient's mouth. That's it. Okay, this is just a gel you insert. It will take the shape of the larynx. This is your Giddle airway. It's also called as a oropharyngeal airway, OPA. It's also called as a mouthpiece. This is all used in emergency, okay, during CPR, alright, or to prevent the tongue fall on the posterior pharyngeal wall. When you insert LMA, guys, all you need to do is just open the mouth, alright, slide it at the back after deflating the cuff and stop wherever it stops, and then inflate the cuff. So you need to deflate the cuff so that it becomes thin, open the mouth, insert inside like a pencil. When you're totally in, you inflate the cuff, and that's why it settles here. Because it is lying at the larynx, it's called laryngeal mask airway. Can you see? It's lying at the larynx, outside the trachea, and that is why it does not prevent aspiration. That's why aspiration can take place, though it has a cuff, but the cuff is not inside the trachea. That's the point. Okay, so this is your LMA, and that's exactly why ProSeal LMA is important and a better device, because with a ProSeal LMA you will have a channel from which it goes directly inside the stomach. Hopefully this point is clear, guys. Okay, now with the next image, chest compression to ventilation ratio is, everyone, answer jaldi, fast. Dr. Akshay says one answer. Yes, other people. Dr. Akshay, I hope you understood IGEL. You asked me that question. Hopefully I've understood. I showed the diagram. Dr. Ganesh Murthy says D. Dr. Mazin says B. Dr. Chandan says B. So I've got answers C, D, B. Dr. Aniketan says D. Okay, Dr. Akshay says yes. Okay, so you understood the point. Dr. Rahul says D. So let me clear the point. Again, confusion, guys. Important question. CPR, always a question comes in the exam. Okay. Wherever you are giving CPR, guys, the chest compression to ventilation ratio is always 30:2. Correct. Everywhere. If it's an adult. Okay. Single rescuer or two rescuers. Correct. 30:2. However, if it's a child, okay, if it's a child and you have a single rescuer, the answer is 30:2. A child with two rescuers, as you are seeing, child with two rescuers, the answer is 15:2 MCQ question, and this is what is asked in the exam, and this is why this correct. Dr. Santosh, Dr. Kiddy, they've given the answer now. Correct. The correct answer is 15:2. It's not 30:2. Routinely everywhere chest compression is 30:2. Adult, if there is one rescuer or two rescuer, means if you are alone, lonely, it is 30:2. Okay, so you do 30:2, 5 cycles in a span of 2 minutes. That is what you're supposed to do. Okay, in a child, if there is a single rescuer, you will do 30:2. However, child with two rescuers, guys, becomes 15:2. So the correct answer here was with the image 15:2. Dr. Ganesh says forgot to see the image. Dr. Ganesh, that is why. See, in the first question, I forgot to see the image. See, I have set up the questions and I forgot to see the image. If you remember on the cylinder, okay, you remember that air wala confusion which I made. So I have also myself made a mistake, though I have set it up. So imagine when you are appearing in the exam with almost tension and anxiety, we tend to make mistakes. That's why we need to be relaxed, okay, and we need to be clear about our concepts. So you realize even if you go back to my YouTube, this video that is getting recorded, you will find that I was explaining continuously about the air cylinder, but I had marked the answer as carbon dioxide. I was speaking about air all the while discussing with you guys, all of you, which is still recorded, and the answer that I marked was carbon dioxide, that too after so many years in anesthesia, almost 20 years yaar. Uske baad bhi. So I can make mistakes. So imagine everyone can make mistakes. I mean, not that I know everything, but I'm just saying that I'm not giving an exam immediately right now. But when you're sitting in the paper, guys, even these small things make a difference to it, okay? So please take your time, study well, clear your concepts, be relaxed. If you play guitar, you can dance, okay, whatever you like, have some free time, see Netflix, okay, and the remaining time you can see Unacademy as a Netflix sort of a thing, okay. So you can just download our app and go through all the lectures that we have. All right, so we are already running the revision batch. This is also going on. Dr. Santosh says want question on congenital heart defect. Yeah, but then questions. Okay, so we'll discuss sometime now, but congenital heart mein anesthesia mein less questions are coming. Next time I'll try to include 3 or 4 when I'm discussing MCQ. So I'll be coming again after a while on YouTube also. So you have my videos on YouTube. Apart from that, you can always download the Unacademy app here and just go through the special classes which are completely free. The special classes you'll go and see, including me and all of us, have completely free. So you can go and see there also all the discussions that we've had. Okay. So if you find any subject is not good, I mean, you're not very well prepared, you can just go and see. I'm not saying just download one thing. I mean, YouTube videos are also there where I've discussed so many points. The special classes are there which are completely free. Just download the app. And remember, nowadays you have to use a code. So you can use my name as the code. Other thing is that my Telegram ID is Dr. Vinish. The same thing, DRVINISH. I'm the only one in the whole Telegram as Dr. Vinish. Okay. So you can just search for me, t.me Dr. Vinish, search, and you can get in touch with me. Any questions, I'll try to clear there. Okay. So this is for the intensive batch, revision batch, which is going on. And thank you for joining me at this session. And thank you guys. Remember, the code is Dr. Vinish. Nowadays, to unlock everything, you need to have a code. All right, guys. So hopefully no other questions. Thank you so much for joining me. Remember, this is my Telegram ID, just Dr. Vinish. Okay. Dr. Mazin says, nice session. Thank you, Dr. Mazin. Thank you. Okay. Use the code, download the app. You just have to use the code. Okay. So you can go through all access to all the special classes. Okay. And any questions or doubts, you can ask me at Telegram, Dr. Vinish. Just search for me, t.me, search and type DRVINISH. It's not a channel. You will get in touch with me directly. Dr. Ganesh Murthy, thank you. Dr. Santosh, thank you. Thank you guys. Okay. Thank you. Till the time we see next time. Any doubts, you can ask me. So I'll be coming again with another YouTube session, or you can go through all the sessions that we've had at Unacademy. Thank you so much for joining me. Okay. It was a wonderful session, guys. I enjoyed it too. Thank you. I had thought for only 30 minutes. We went on to almost 45 minutes. Okay. Good night. All the best. Do well.